Hi everyone, my name is Dr. Zolkowski and I work at Pennsylvania College of Health Sciences, and right now we are in the college at Pennsylvania College in Lancaster, PA.
And my name is Sue Wigglesworth, and I'm a nurse over at Lancaster General Hospital.
Okay. And what I do at Pennsylvania College of Health Sciences is I am a nurse teacher, so I help students learn how to become a nurse.
And what I do at the hospital is I work with patients of all different ages, and you're going to see that in a moment as we go through them: the pediatric, the kids, the babies, and the elderly.
And what I like about my job as being a nurse teacher is helping students learn, and all of a sudden they get excited and the light bulb goes on. That's my favorite part about being a nurse teacher.
My favorite part of being a nurse is helping people get better and get them home. I also love educating while they're in the hospital, why they're taking medications, what's going on with their disease, and then talking with them and trying to figure out what's best for them.
What I don't like about my job as a nurse teacher is probably the same thing your teacher doesn't like about being a teacher, is all the paperwork. Paperwork. And we always have to do the paperwork when we go home in the evening or on the weekend. So that's what I don't like about my job.
Same here. I don't like all the documentation we have to do. Charting on everything a nurse does. If it's not charted, it's not done, is the motto. So we have to chart everything that we do: dressing changes, medications, education, anything that we're doing to patients. So it can get a little tedious and it takes time away from my patients, so I don't like that part of it.
As far as education, my educational background: to become a nurse, I received a BSN, a bachelor's degree, and then to be a nurse teacher, I had to go back to school to get a master's degree. So I also have a master's in science of nursing. In addition, I chose to go back to school again for a doctorate degree, so I have a PhD in addition.
So my education starts with a bachelor's degree in nursing, and that's when I was working on the floor. And with a bachelor's, you can become a nurse manager there, or you can be a staff nurse. You can move to all different departments with that bachelor. If you want to go on, you can, as I did, and I got my master's in nursing education, so I can do more teaching at a different level, whether it's college or in the hospital itself.
So let's go into our lab, and you can see Sue was a former student of mine, and she's going to show you all that she learned and how to be a nurse with different patients of different ages. Now in the skills lab at Pennsylvania College of Health Sciences, and Sue and I are going to talk about all the different places that you can work if you become a nurse. So right here we have a pediatric patient, so sometimes our students graduate and become pediatric nurses.
Sometimes they like to head to the intensive care unit, which would be the ICU.
Sometimes you can work in the emergency department. Say you fall down the stairs and you break your arm, you would go to the emergency department.
Or maybe you love babies, so maybe you work with labor and delivery. That would be the moms and the babies.
Some students, when they graduate, they end up working in the operating room, so they will take care of anybody who needs surgery.
And then there's always the home care nurses. They'll go out to their homes and make sure these patients are doing fine and doing okay.
And sometimes people enjoy working with elderly patients in a nursing home. And some people also enjoy working with patients in hospice at their end of life. So there's some of the different places that you can work at.
And what's nice about it, if you don't like something or you want to try something different, you can change into different areas of nursing. There's so many to go to, and you can retrain. Once you have that initial training, it opens up the gate for you.
And now Sue is going to show you some of the things that she learned to care for a young patient, a pediatric patient.
This is our pediatric patient. This is Junior. He was out riding his bicycle and he didn't have his helmet on and he ran into a car. So as you can see, he has a pretty bad head injury here and has a concussion. So some of you may have had concussions in your sports that you've had, or maybe you ride your bike and fell off of it and have a concussion. But we're going to keep an eye on him for the next couple of days and make sure his brain isn't swelling and make sure that he can talk and he can do all the things he needs to do. So part of that is just assessing the pupils, and we'd go in and out with the light and see if they're responding. Are they going smaller or bigger? Are they responding correctly? Can he speak to me correctly? Does he know who his parents are? I mean, these sound like silly questions, but sometimes with a head injury, you can lose some of that. So some of that too is about educating the parents and teaching them what to look for signs and symptoms if he was to feel if the concussion was getting worse, if his brain was swelling or there was an issue. So I would talk to them as well. So as a pediatric nurse, a lot of times you have, like we want to say 2 patients. You have both the child and then you have the parents. You got to make sure you're bringing them along board. So some of that's going to be just listening to lungs, listening to his heart, listening to lung sounds, which is going to be always underneath the gown. So we take a listen, and he's breathing okay. Is he dizzy? Is he okay to walk? And then maybe I would do some more assessments on him when we go down and we see that he can grab my arm and he can, grasp things fine. Now this one is a diabetic patient, so he's going to need some insulin. So I'm going to show you one of the things that nurses do, and is one of my favorite things, is to give injections. So some of you may not like injections, but they make people feel better. So as a nurse, you'd be grabbing this fun equipment here, you'd be cleaning it off, right? We get our insulin needle, and we would look at the doctor's order to make sure this is all ordered for him. I don't just come up with this on my own. I have to follow the orders of the doctors. We'd pull out the proper amount that they would need, and then we'd go to the patient. We need to let them know what we're doing, right? Because I don't want to just come in here and be like, start stabbing them. Wouldn't like that. Hey, Junior, we're going to be giving your insulin shot today, so I hope you're okay with that. Yeah, that's okay. Your blood sugar is a little crazy today, so we're going to make sure that we're staying on top of that. So we're going to give it into your back of your arm over here. So I'm going to clean off the site. Well, here, I'll do it on this side so you can see a little bit better. This is actually to put his muscle, but I can show you what we're doing. You'd clean off that site really well, and then we would pinch it, give it, and then we come out. And then you always put the safety on. You don't want to get stuck with a needle. This would go into a red sharps box because we don't want to get stuck. And then we make sure he's okay, right? Are you okay? Yeah, I'm okay. There's probably some crying, but that's all right. And that's our pediatric patient.
Hello, here we are in the newborn nursery at Women's and Babies Hospital, and Sue's going to show you what a nurse would do caring for a newborn baby.
So some of you may have little brothers and sisters. Most of you won't remember this when you were a baby, but things that the nurse does while they're in the nursery are going to be taking a listen to their lung sounds, their heart sounds, and you're going to be kind of reporting anything that's not correct or not good for the baby. So you take a listen here. Some other things you might do is like a head measurement. You want to do their weight. You want to make sure that they're gaining weight while they're here, because some babies, maybe they're not eating and this one's upset. So as a nurse, I would have to come in here. We need to see what's going on with the baby. Possibly could be hungry. Possibly could need just a pacifier. This baby, as I can see here, needs their nose cleared out because it's really congested. So I'm just going to be cleaning nose out. Get that clean. Oh, they don't like that when you get in their nose. So these are just some of the things you do as a nurse. And you would also be taking care of the mother at the same time. She'd be in another room, and you could be going in there and assessing and seeing that she's doing okay too, because she just gave birth. And this is the nursery. All right, and here we are in the geriatric area. This is Jerry. He is in with pneumonia. He had fallen at home because he got dizzy, and so we're checking out his neck to make sure that it's stable and he didn't break anything in there. He also did a little job on his arm, so that's going to be in a sling for now. While he's sitting here in the chair, I was just going to get his blood pressure. So part of a nurse is that assessment, right? It's checking out your patient. So we would push this button. Now, his blood pressure won't be taken because he doesn't really have one, but if he did, we would push this button. It would pump up the machine, and it would pop the numbers on here. Those numbers tell us a lot of things about the patient. They tell if they need hydration. They can tell if they need heart medicine. It's going to give us a lot of picture of what's going on with this patient. Another thing we'll do is his vitals, or his temperature. We get his temperature, we check it. We'd see, now he has pneumonia, so he probably has a temperature, maybe 102, 103. They usually spike pretty high. So we're going to give him some antibiotics later, and we'll talk about that in a minute. So while he's on here too, this machine also does a pulse ox. So this would go on your fingers like this. This gives us a register of how things are going through the blood, if the oxygen is enough for him. And if my numbers are low, I'm going to get some oxygen on him as well when we get him back into bed. So for right now, I need some help getting him back in bed. Kristen, could you come and help me?
Sure.
And here we are, Jerry got back in bed. You always get somebody to help you if you have a patient that's unsteady. It's about safety, right? We don't want them falling. So Dr. Zukowski came in, we got him back in the bed safely, and now we're going to take a look at what's going on here. If you recall, during his vital signs, his oxygen was running low. So I'm going to hook up his oxygen first. That's going to be important. Then I can do my other tasks that I need to do with him next. This here is just a simple face mask that we're going to put on him, and we would turn up the dial, whatever he would need or whatever was prescribed for him. So let's put him at 3, and he'll feel better. So go ahead and take some nice slow deep breaths there, Jerry. As he's taking that in, a lot of times it's a good time to listen to his lungs, listen to his heart. So if we go underneath here, I'm going to take a listen to his heart in many different places. It's always good to hear the different valves in different places. I like to sit my patients up. I'm going to take this out so I can hear myself. I like to sit my patients up so that I can hear their back, and we usually do listen to 5 or 6 places on the back. And his is a little diminished, and it's a little what we call crackles, which is like the pneumonia. So I can hear that he's not doing so well. So that's why I'm glad we're going to have some medicine for him in a minute. I still want to keep this neck brace off until he is cleared. So we'll have to go down for an x-ray, and they'll say, yep, there's no fractures. Then we can take this off safely. But right now, we're just going to leave that on. And I want to check his hand, too. Although this is broken, I want to make sure it's not swelling. I want to make sure that he can move his fingers around and that he doesn't have any pain. Oh, I will need a medicated for pain, I'm sure. With that neck, with this arm, he's probably going to need some medicine later on. Let's talk about his medicine. So I just happen to have some over here. So I may be giving him some narcotics for the pain, and I really want to keep an eye on him because it can make him extra dizzy. We're going to give him other things in here for his heart. He's going to have stuff maybe to help with his bowels, keep things moving. So all these would go into the cup, right? And then I would give this to the patient, and he would swallow this down. Elderly patients, I'm always going to sit up really high so they don't choke, especially with his brace on here. So he could take this in his good hand. He would swallow these down. I'd give him some water, swallow that down, and make sure he takes it all. You're only giving what's prescribed and what's written by the doctor or nurse practitioner. Next, this guy is going to get an IM injection. So that's an intramuscular. That's what the COVID shots are given now, but he's getting a pneumonia vaccine. So I'm going to show you what that looks like. We're going to pull up. I think we'll do it on this side since that arm is kind of already in a sling. Or do you want me to do that side so it's a little closer to it? I can. Okay, so let's pull up this arm sleeve. And we're going to educate the patient. Hey, I have your pneumovax here. This is going to help prevent you getting any more pneumonia. And we would look for the site. We'd clean it off. You've probably seen this on TV with them giving all the shots, all the vaccines that they're giving now. Clean off that area. About 15 seconds, let that dry. I'd have my medicine ready here. We put it in air. We pull it out. I see this too. All right, and I'd have the medicine in here ready to go. I re-scoop this safely. I never recap it. It's a safety thing. Coming in again. I'm going to pinch him because he's a little skinny and I don't want this sticking in the bone. So I'm going to go straight in. Slowly, we're going to give it. Are you okay, Jerry? Yeah, I'm fine. Okay, good. You come out, and if you recall, we always make sure we put that safety on so nobody else gets stuck with this. And then that's also going to go in a red container, a red box that was in their room. So we can massage it or just tap it, make sure it's not bleeding, make sure he's doing okay. So he has his oxygen now. We gave him his pneumovax. We gave him some medicine for pain. The next thing I want to talk about is his IVs he has over here. So as a nurse, you're giving multiple meds to one patient. So you need to know how all these medications interact with each other, how they're going to help them. This medication here is called hydration, and that's going to help. Since he can't swallow a lot of water on his own, he needs extra water. This is going to help him with that. This is called a primary. So this is going into his arm here. I confused the tubing. And then this one here is his medicine that for his new, it's called an antibiotic. So a lot of times you'll see a couple bags hanging up here, and these work together to help the patient. This antibiotic is for pneumonia, and we're hoping that he gets better, right? That's one of my favorite things, right? Get the patient better, get them out the door. I think he's going to do really well. So I think he's going to have a full recovery of this whole pneumonia trip and healed up. So sometimes we have to shoot medicine through the IV. So down here we have medicine. Maybe he needed more pain medicine. Maybe he needed something for, because he has a lot of fluid that needs to go, but we would stick this on the IV. Can you see this? So I'd stick it in here and we would shoot it through and make sure that he gets it right into his IV. That really hits the patient faster and they can feel the effects of it that way. So again, this is all the training that Dr. Zukowski had to do with me when I was in the nursing program. We had to talk about medications, injections, oxygen. We have to talk about the IVs, and we talk about the babies, we talk about the pediatrics. You're putting this all together when you're in nursing school. And then you can figure out what path you kind of want to follow when you get out. But it gives you a good picture. And then when you get out, you get into a certain floor and you really learn it well. Those different specialties that we talked about earlier. So thank you for coming today, and I hope you guys have a great rest of your day. Bye.